The demand for mental health care far outpaces the available resources. We know that. But in one Boston neighborhood, people in crisis, they have a new option. East Boston Neighborhood Health Center has officially opened its new behavioral health urgent care service aimed at providing same-day service for crisis evaluation and psychiatric consultation. I got a tour of that new facility and learned how they are responding to a growing need. More than 300,000 people visit East Boston Neighborhood Health Center every year, the largest facility of its kind. Their population of patients are low income and high need. Access to high quality mental health care is a big one.
The biggest problem that I see is when a patient needs care, when they decide today is the day I need help, when they go to look for that care, they can't find it.
According to the U.S. Department of Health and Human Services, 1 in 5 adults has experienced a mental health challenge, and 1 in 20 live with a serious mental illness like schizophrenia, bipolar disorder, or severe depression. More than half never get help.
The wait for appointments throughout the state for both medication management and counseling are just so lengthy.
Their answer to that problem is this new behavioral health urgent care unit.
They're industry standard for creating calm, trauma-informed, aesthetically pleasing spaces.
I got a tour guided by Michael Mancusi, VP and Chief Behavioral Health Officer. From the art on the walls, custom made to prevent injury, to the layout of the rooms, every detail in the unit is intentional. That includes this streamlined metal detector aimed at keeping the space less intrusive.
And it's got 1, 2, 3, 4, 5 points.
On-demand virtual interpretation services.
Whether they speak Spanish, Portuguese, Arabic, or some other language.
In addition to bilingual staff, helps eliminate language as one of the hurdles to accessing mental health care.
Everything here needs to say, you're welcome, we're going to take care of you, you're going to be in comfort, you're going to be safe.
High costs, social stigma, and racial disparities in care are also high in the list of barriers for patients, according to experts in the field. Clinicians at East Boston Neighborhood Health Center hope this facility will break down those walls.
It is critical because if a patient needs help today, but they can't get an appointment until a month from now, their entire situation could be very, very different.
And now I'm joined by East Boston Neighborhood Health Center's Executive Vice President and Chief Operating Officer, Ryan Boxill. Their Director of Community Trauma Support Services and Mental Health, Erin Bourgault, and Nia Jones, Director of Youth and College Division with the Black Mental Health Alliance. Thank you all for being with me to talk about, what is a growing issue across the country and here in Massachusetts. Ryan, I'll start with you. This is an amazing facility, but also it's a level of care and thoughtfulness, and also the attention to detail, the privacy to the patients as well that will use it. So talk to me a little bit about that intentionality.
Sure. So what we wanted to do is to affirm the humanity of our patients. And so when we built the facility, we were very intentional about safety, but also a place that people would go and feel like they were valued and cared for, that was compassionate, and a milieu where healing could take place. So even though the facility is built to inpatient psych specs, which is the most acute level of care we have, we treat folks who walking from the community. And one of the things we're very proud about that you talked about in the piece is that I myself, if today I need medication, I need therapy, if I call, it'll probably be months before I can get it. But for our patients who may not have insurance, who are below 200% of the poverty level, they can get medication and psychotherapy the same day. And that is something that we're extremely proud of, and we're able to bring that to the community.
Erin, how important is it, this approach to mental health care?
So it's been incredibly important to provide that immediate access for people in need, and also, as Ryan had mentioned, really promote healing. So we are, through this service and our other behavioral health services at EBNHC and that we offer in the community, really supporting patients' ability to receive services and really access their own ability to heal themselves too.
And one of the things that struck me was it's not just a space. Like the art is on the wall, but it's also safe for folks. The colors are chosen to be calm and soothing. And I understand there'll be other services that'll come into play there, like meditation or yoga, and having practitioners come in. That's all things that seem to me go above and beyond what the base level of care is. Would you? I imagine that was designed that way, right?
Yes, we're very intentional about it, and we believe in treating the whole person. So we have behavioral health integrated with physical health at our facility. It's not a separate place that you go. Traditionally, behavioral health is, you go, the building isn't as nice as the physical health. We try to make sure that it met a standard that I would want to go to, I would want to send my loved ones to, and so that's the standard that we set. And being holistic, we look to bring in other healing arts. So it's not just, as a provider, me saying, well, it just needs to be, the things that I learned when I was studying clinical psychology. We're doing Reiki, we're doing yoga, we're looking at the whole person and bringing all these different pieces to bear to help the individual.
Yeah, absolutely. And Nia, we talked about the statistics. 1 in 5 adults has experienced a mental health challenge. More than half of folks don't get help. How important is it to have a resource, especially in a neighborhood health center?
Absolutely. So I love everything about this project, in that, I always tell young people, especially, you have mental health just like you have physical health. And so having access to things in addition to therapy, I think really brings not just trauma-informed care, but it really taps into healing-centered engagement for the individuals that will be seen in this space, and that they're able to affirm all parts of themselves and really explore kind of like different outlets for their mental health. And so I think that, certainly when we're, as clinicians, working with patients and clients, being able to have these kind of non-traditional spaces and help them to feel safe, it will certainly help with their healing.
Well, because we know there are so many barriers to folks having access to even asking for help. One of them being stigma, being a big one. I imagine that's a big one in the youth population that you help.
Absolutely. I think that it is certainly decreasing with all the people on social media, talking about mental health, and just the last 3 years, nationwide and even globally, living through an entire pandemic, people are being a lot more open and honest about their mental health. But in the Black community specifically, and in urban areas, we still have some, remnants of stigma left over, in which people are told to, pray about it, or, what happens in this house stays in this house. And so being able to push past that stigma and then going to a place that is very affirming can certainly start the journey for someone to work on their mental health.
Absolutely. Erin, I also know the population that comes to East Boston Neighborhood Health Center, and I was so impressed by the translation services, how many languages can be accessed to help all populations. Why is that so important?
It's so important because we really work with so many immigrants, and so our role at the health center is to really accompany them and make sure that health equity is at the center of everything that we do. And our interpretation services department supports us so much with that. I think also having bilingual and bicultural providers, and especially thinking about these healing modalities. We have immigrant community healers that we work in coalition with. So it's really services through the Community Healing Center project that EBNHC is a part of for and by the community. So really having community partnership as a centerpiece of that as well.
Yeah. Please.
An important point that we're very proud of is around translations. We do over 200 different languages that we can translate. Last year we did about 205,000 translations. This year, we're on pace to do over 220,000 translations. And when you look at, unfortunately, it's important for patients when they show up to see people that look like them. And when you look across mental health, when you look at clinicians, only about 20% of clinicians are people of color. At this facility alone, we have more than doubled that just in our Latinx clinical staff. And so what we're very intentional about is to try to make sure that when patients show up, they see people that look like themselves, that understand their culture, and we think that that goes a long way in the healing process.
And I'm also thoughtful about how, and to go back to your point, Ryan, where a person can come in with, say, they're in an acute mental health crisis. You treat that, but maybe they also need a checkup for a health issue that they've been ignoring because of this acute mental health crisis. And maybe they've been on a waiting list, or maybe, we've all tried to make a doctor's appointment outside of, the normal, everyday happenings. But it almost ends up being a one-stop shop for acute care in general.
Yes, the cool thing about the building, 10 Gove, is that the emergency department is on the same floor, and it's just steps away. The pharmacy actually shares a wall with the facility. So you can essentially come in, urgently needed therapy and medications, and you can go next door and get those medications right away. If it's an urgent issue, we can take you to the emergency department, or patients are referred from the emergency department to this facility, because the emergency department is not necessarily the best place for a patient going through a psychiatric crisis. And so that's why we wanted to actually build this facility where it would be separate. If you go up to the second floor, that's where our adult medicine practices are. And if you go up to our third floor, that's where our pediatric practices are. And we also have same-day pediatrics. So a mom can show up the same day without an appointment and get care. So you can essentially walk into one building, get emergency care, full course of behavioral health, medications and psychotherapy, crisis and treatment intervention. You can get adult medicine and pediatric medicine all within the same building. And so that's something, again, that we were very intentional about when we were looking to put this facility together.
Yeah, and Nia, I'm thoughtful of that too, because one of the psychiatrists on staff that we heard in the piece, Laura Petrillo, was talking about the fact that when someone is ready to get help, you got to catch them in that moment before they change their mind or a life circumstance happens. And so talk to me a little bit about that work around making sure when someone's ready to get help, or if they need help right now, how important that moment is.
Absolutely. Time is of the essence. And so what we see a lot of times, and you all have already mentioned it, is that wait lists are long for mental health providers. And so being able to see a patient and get them medication and actually begin to take that journey with them for their mental health is crucial, because, the longer time, the longer amount of time that that individual then has to process within themselves or with a family member that may, not necessarily have the skills that that person would benefit from, all kinds of decisions could be made, right? And so we know that could then impact future generations, that can impact, their children, their families. It could also have an impact on their ability to go to work. And so often that is usually the first thing that gets cut, is that, if I'm having a mental health crisis or just trying to process through some things, I don't go to work. And then what does that mean? I can't take care of my family, or, I automatically seem weak, or, I can't afford to not do this. And so if that person has made the decision to get help and they're able to go into this space, it's transformative in its impact on that day and on days to come, for sure.
And we've certainly seen a rising number of folks who are in this mental health crisis, especially since the pandemic. Talk to me about what you're seeing at your organization.
Yeah, so the Black Mental Health Alliance is dedicated to really taking mental health to the community. So our founder was very cognizant about the fact that, especially in Black communities and in urban environments, that individuals would go to the community first for healing. And so we are all about really training individuals in the community around what mental health looks like and sounds like. What then can you do if, for example, just what we just talked about, if a person comes to you that wants to make a change in their lives, how can you help from step one? And so we're seeing, young people that are taking control of, being able to inform their peers about mental health. And so they take classes with us to be able to learn about, different mental health diagnoses and then be able to help their peers. We're seeing adults who are sitting with us in barbershops and beauty salons to really be able to, again, reduce the stigma and have conversation about mental health. And so we're seeing people really, engage with our organization because they want to get better. I think the issue is often what we've talked about here, that when they make the decision, really getting access to an individual. And so we hold a database of psychiatrists and therapists who are ready to be able to have conversation with and accept new clients. But we also provide what we call wellness check-ins, because there needs to be a bridge between, the first appointment and you making that decision. So we stand in the gap with individuals to have quick conversation about, I'm a listening ear to be able to support you. And so people want to get better. It's just a matter of where do they go. And so individuals, organizations such as what we're talking about today, as well as the Black Mental Health Alliance, standing in the gap, I think people are going to get exactly what they need.
I like that, standing in the gap. And Ryan, in our last 30 seconds or so here, talk to me about how important that community-centered approach is, because that's what you all are all about there.
Yeah, so I think, as they say, it takes a village.
It does.
And behavioral health is one of the main drivers of bad health outcomes on the physical health side. And so you really can't do good physical health intervention without first doing behavioral health. But, as I heard a colleague say, we have done a great job of medicalizing poverty. And so a lot of what we're really seeing are the consequences of poverty. And so what we've tried to do, by the time somebody shows up in the exam room, it's almost too late. And so what we've tried to do is to go upstream by providing over 200,000 meals a year,
right,
by helping folks with housing, social justice. So I think you have to take a complete community approach and look at it from that way, because the patient doesn't leave us and go into a glass bubble.
That's right.
They go back into the community. And so we view ourselves as not just an organization that works with the community, but we are a part of the community, and it requires the entire community to heal that individual.
Yeah. Well, thank you all for being with me. Great conversation.
Thank you.
Thank you.
Thank you.